Yeah.
Lord, I'm blinded by your grace, by your grace. I'm blinded by your grace. I'm blinded by you. I'm blinded by your grace. I've been broken. No one worthy. You fix me. I'm blinded. Sing it up. Your grace. Sing it up. Sing it up. One time to the Lord. One time to the cross. One round of applause. One time to praise the T Smith on the floor. I'm doing it. I stay prayed up, then I get the job done. Yeah, I'm happy to suit. What's up? Well, up now. What's done? The main stage, when I'm this. The whole next, I tell them the this. Was I reckon I'm this. When I dare you stop my verse. You say this killed him, no yes. It's not my girl.
All right. Good morning, good afternoon, and good evening, ladies and gentlemen. Depending on where you find yourself in the world. Um, Sami, can I confirm that I can be heard? If I could get a thumbs up, or if I could please get any emoji showing that you can hear me, I will be super grateful. So in the chat box, if I could get a thumbs up or any emoji showing that people can hear me, and then we can go ahead and kick things off. I'm not getting any responses.
We can hear you.
We can.
Oh, okay. All right, lovely. All right, so like I made mention of, good morning, good evening, good afternoon, depending on where you find yourself. Um, my name is Kingsley Osebwati, and I happen to be a very good friend of Dr. Norman's. And I do have the privilege and honor of being the MC or Master of Ceremony for this special book launch. Dr. Norman is somebody that has always been very passionate about sharing his knowledge with others, and it goes way back to our days in high school in Ghana. So it's not surprising to me that, as he continues his career, he's still on that adventure of sharing his knowledge and then making sure that we can go ahead and make life better for the rest of the world. So, as you're all privy to, the title of the book is Healing the NHS, A Physician's View for Change. And one great thing that Dr. Norman does is that not only are we going to be hearing his perspective, but then also we will get to hear the perspective of patients, and then also that of others that are not in the medical field. So it's going to be an all rounded book that helps to capture everything. So, without much ado, as a way or as a teaser to show what is coming, I would love for us to go ahead and then watch an introductory video about the NHS, which is going to take about 5 minutes, so that you get a snapshot of some of the issues that will be addressed by the book. Hi, Samuel. So if you can go ahead and then display the video, I will be grateful. Samuel, can you hear me? Or Dr. Norman, would you be a co-host if you have access to the video and you could display it?
All right, Kingsley, just a minute.
number is 6 times higher than just a year ago. If the NHS were a patient, these long waits for ambulances and hospital beds would be clear symptoms of poor health. But the NHS isn't a patient. It's supposed to help them. And in England right now, the ambulances record-breaking waiting lists and a workforce struggling to make ends meet. The National Health Service is in crisis and winter is coming. Across the UK, hospitals are at breaking point.
We see times when we can't actually get any patients through the door at all.
Here at Rotherham, they are running out of beds and the patients keep coming.
Resource is full. I've got red firm going off, so we've got to now make that decision of who do we move out of resource to actually get this poorly patient in. Any other ambulance now coming in is going to start queuing unless we actually get some beds or anybody discharged from the department.
But there is no space. The hospital's wards are already full and nobody can be discharged. Patients are made to wait in corridors.
Hello.
Jane has spent 20 hours on a trolley because there are no beds left and nowhere else to go.
I've been here since yesterday after 3.
Are you okay here?
Yeah, I'm putting up with it.
That's just one story of an NHS pushed to the limits. At the other end of the country, Alison has a similarly terrifying story. She was taken by ambulance with chest pains to the Royal Cornwall Hospital in Truro. She waited 3 hours before seeing a doctor.
They took me in on the trolley. They did ECGs and blood tests, then sent me back out to the ambulance.
She was eventually told she hadn't suffered a heart attack, but Alison was still in pain. So out of sheer desperation, she and her husband, who lived just 30 minutes from Truro Hospital, drove 5 hours to London's Charing Cross.
And you were there for how long?
I was there for 9 days in the end.
These stories are being repeated all over the UK because the NHS is on life support. When you make a phone call to 999, an ambulance is meant to arrive within 18 minutes. At the moment, that average wait time is actually 48 minutes, over 2.5 times longer than the target. And for those who make it to A&E, 1 in 12 having to wait more than 12 hours to reach a hospital bed, even after it's been decided they should be admitted. That number is 6 times higher than just a year ago. If the NHS were a patient, these long waits for ambulances and hospital beds would be clear symptoms of poor health. But the NHS isn't a patient. It's supposed to help them. And in England right now, there are a record 7 million people in the waiting room. More than 4 million of those will have to wait 18 weeks or longer to be treated. And over 400,000 would wait a year or more to get help. That's 1 in 18. The impact of the pandemic has piled pressure on the NHS and added to long waiting lists. But the worrying trends around patient care stretch much further back than COVID.
This isn't new. It was happening well before COVID. The winter all year round, the pressures that are unsustainable on the NHS. And the sad thing is, when you talk to the staff and when you talk to patients, they seem to just accept it, that this is the way things are now.
Such a poor diagnosis might help to explain why an NHS is having huge problems hiring and keeping staff. Right now, there are 132,000 job vacancies in NHS England, and 1 in 9 health workers left the NHS in 2021 alone.
A lot of people are looking in particular at retirement and maybe taking retirement early because of the stresses.
The pressure is phenomenal and there's not enough pay.
The government has offered the majority of NHS workers a one-off fixed pay increase of £1,400. But because of the state of the UK economy, the pay increase the government is offering means no NHS staff members' pay will rise in line with skyrocketing inflation, which is why nurses have voted to go on strike for the first time ever. Winter is coming, bringing with it more flu and more cases of COVID, piling on the pressure to a system buckling under the strain. Hospitals and staff are already stretched to breaking point, and stories like these will be played out again and again all over the country.
Oh, when I became a surgeon,
All right. Well, thank you very much, ladies and gentlemen, for your indulgence. I know that at the initial stages of the video, there was no sound, but then we were able to get it reconnected to where we could hear every single message that the video sought to send. And one big thing that resonated so well with me was the fact that if the NHS were to be a patient, it would have been in a poor health, right? It would have been in crisis. In some cases, we might qualify to say that it might have been in the ICU by now. But then here's a case where the NHS is not a patient, but then it's rather there to help people like us. So I'm so glad that Dr. Norman has taken the time to share his experience through a book, which to me, to a huge extent, could be a beneficiary could benefit each and everyone because you don't know where you could find yourself and you could fall sick and you could benefit from some of the improvements that he's suggesting. So, Norman, thank you very much for taking the time to chronicle all your experiences and putting them together. So, ladies and gentlemen, like I made mention of, this is not going to be, a tunnel vision book. It is going to be a book that we would get other perspectives. So, it's my pleasure to introduce you to a fine gentleman who is going to go ahead and then chair the event for us. So, I'm going to go ahead and give you a brief snapshot of his profile, and his name happens to be Dr. Ogba. So just a quick intro about his bio. Dr. Oba is a consultant liaison psychiatrist that is based in Scarborough General Hospital. He obtained his primary medical degree from the Abia State University in Nigeria in 1999. So it should tell you how much experience he has under his belt. He's a member of the Royal College of Psychiatrists and also a diplomat of the Royal College of Obstetrics and Gynecology. He also has a master's degree in public health from the prestigious University of Aberdeen in Scotland. And he's worked in several NHS hospitals since 2008, both in Scotland and then also in England. So, ladies and gentlemen, I would love to get some few remarks from Dr. Oba, and then we can go ahead and proceed with the book launch. So, Dr. Oba, the floor is yours.
Thank you very much, Kingsley, for that wonderful introduction. Today is a great day. Today is a joyous day. I am so privileged to have been asked by my friend and brother, Datel, Dr. Datel Norman, to be the chairman of this book launch. I can remember several months ago, we were having a private chat about the difficulties, that we all experience, we've been experiencing in the NHS. And he told me, do you know what? I said, no. He said, I'm actually writing a book and the book will soon be published. He said, wow. And he told me the topic or the title of the book, which is Healing the NHS, the physician's perspective. I've taken time to read this book, and I would say that this book is an encyclopedia of the NHS. The NHS is very dear to us in the United Kingdom, and the NHS has been a difference between life and death to almost everybody in the NHS, because we've all used it in one way or the other. We're all beneficiaries where we use the NHS, and it's so lovely in that it is free at the point of service. So everybody, you can walk up to any accident and emergency unit, any hospital, and treatment is free. I mean, I have my background. I am originally from Nigeria, and I know about the healthcare system in Nigeria. And when I compare it in the UK, so I know all the gains and I know the pains and I've been working in the NHS for more than 10 years now. So this book wouldn't have come at a better time. Dr. Norman has taken time to x-ray, to go through the foundation of the NHS, the aims and objectives of forming the NHS. It's also helped to compare the health system in the UK with that of other developed countries like Australia, Canada, United States of America. And also if you read the book, you also see some experience as well from his time in Ghana, giving the perspective from a developing country. I will recommend this book to everybody. And the good thing about the book is that apart from x-raying the different difficulties apparent in the NHS, he's also been able to give his own perspective, the way he's saying it, and has also profiled solutions. So this book is a must read if you want to understand where the NHS is, where we're going. I would highly recommend that you get a piece of this book. So thank you very much, everybody that has come, and we'll still have further discussion about this. Thank you.
All right, Dr. Ogba, thank you very much. That was very insightful, putting into perspective your own experiences, and then also, how you even got to hear about the book, just having a private chat, and then out of nowhere, Dr. Norman pops up with this surprise. So, you said something that was very intriguing to me. So I've had the privilege of living in the UK before, and I'm currently based in the United States of America. And it may interest you to know that out here in America, um, Americans feel like people in the UK are spoiled. So whenever they talk about, the NHS being in crisis, then many of Americans will tell you that then the American health system is in coma, or some will even go to the extent of saying that it's been buried. Because you made mention of a great fact that the NHS is free, as and when you need a service, you can walk in and then get treated. But trust me, out here in America, healthcare could get somebody bankrupt. Because I personally know somebody that was worth millions of dollars, got into an accident, broke some bones, and came out of about 15 surgeries. And he was in debt to the tune of about $900,000. So, like you made mention of, this book couldn't have come at a better time. It helps us to juxtapose health systems, see what is great elsewhere that can be adopted into the NHS. And not only is Dr. Norman highlighting the pains in the NHS, but then he also goes ahead to make some great recommendations. So not only is he sharing the pains, but then he has some great thoughts that he thinks is going to go a long way to help improve the system. So thank you very much, Mr. Chairman, for all those insights that you shared with us. So going ahead, I made mention of the fact that, it's not only going to be Norman's perspective, but then we'll get the perspective of others. And this is going to be in the form of a panel discussion where we'll bring some other experts and then also some patients to share the patient's perspective as well. So it's my pleasure to give you a teaser of what is to come. The folks that we will be getting the chance to listen to, getting some divergent opinions so that we can put the book into perspective. So, as part of the panel that will be helping us to have a discussion today, we will have with us Dr. James Story. And Dr. James Story grew up in North Wales, in the coast of North Wales, before moving to Leeds in Yorkshire, where he studied medicine at the University of Leeds, and he graduated in 2001. He started pursuing his medical career and worked in various hospitals across the west and north of Yorkshire, in addition to OOP years in South Australia, before completing his training in acute medicine and being appointed as a consultant as an acute physician consultant at the Leeds Teaching Hospital in 2012. His areas of interest or expertise are in utilizing stimulation methodology, specifically focusing on the importance of non-technical skills or human factors in healthcare delivery to improve quality of health, patient safety, and the training of all doctors and AHP clinicians of the future. And besides Dr. Story, we will also have a patient who will give us the patient perspective, because many a times you get it from the doctors, but then not from the recipient. So we are very privileged to have a patient who goes by the name Mike Aspen. And Mike is a 46-year-old gentleman and a father of one angel son and two teenage girls. He had a heart attack in January 2024 with 3-vessel disease due to severe proximal LAD, moderate mid LAD, severe RCA corporate with thrombus, occluded with retrograde filling. He has 2 stents fitted through his wrist. After unstable angina development that he developed in February 2024, and a further 2 stents were fitted, plus the original 2 expanded through both wrists. He's currently recovering well, though he's had some problems with speeches. So he's going to be a great person to share some perspectives as to his personal experiences with the NHS. Mike has been a QA test analyst for a large management software house for the last 15 years. So you get to hear it from Mike, who's had a recent experience with the NHS, which is as recent as January 2024. So like I made mention of, this is going to be a very divergent pool of panelists that will share their perspective with us. So ladies and gentlemen, we will go ahead and proceed, and we get to hear the crux of the book. Like we get to hear the details of the book. So it's a great pleasure of mine to introduce to you the author of the book. And I'm going to go ahead and read through his bio for you, just so you can get to see the expertise that he brings to the table. So the author is a specialist geriatrician at the Harrogate District Hospital in the United Kingdom National Health Service. He has also worked as a consultant geriatrician. He holds a Bachelor of Science in Human Biology from the Kwame Nkrumah University of Science and Technology in Kumasi, Ghana. He graduated as a medical doctor in 2007 from the same university. He holds a fellowship in general internal medicine from both the Ghana College of Physicians and Surgeons and the West African College of Physicians. Dr. Norman has worked in various hospitals in Ghana up to the level of a senior physician specialist or consultant. He was the head of internal medicine department at the Holy Family Hospital in Techiman, Ghana, and has trained several other specialists. Okay, all right. So that is just a snapshot of Norman's enormous experience as a physician. So, ladies and gentlemen, it's a great pleasure of mine to introduce to you Dr. Dartel Norman as he walks us through the book, Healing the NHS, A Physician's Perspective.
Thank you, Kingsley. Thank you. Thank you very much. I will start. I hope you can all hear me.
Yes.
Yeah, I want to make some acknowledgements and dedication first before I go into the book. I want to dedicate this book launch to my mother-in-law, who sadly passed away a few days ago, Madam Amaduma, who miss her. I also dedicate the book to my family, to my wife, the kids, to my parents, Mr. and Mrs. Stanley Norman as well. I also want to acknowledge Dr. Abeku Hammond, who was one of the first few people to have a look and read some portions of the book. I think he'll be joining us soon. So I'm grateful to him. I'm grateful to the panelists, Dr. Ogba Onwuchekwa. He's also a chief. That is not in his bio. He's Mayogun of Osenikite. So, Dr. Ogba, thank you for taking this on. I want to thank Dr. James Torrey for agreeing to also share his perspective as a consultant as well. And I also want to thank the Aspen family, Mike and Bevan, for agreeing to do this at all. Really, really grateful. I want to thank all colleagues who are here. Pastor Benny, thanks for joining. Of course, Kingsley, like he said, Kingsley is a colleague from senior high school and is joining from the United States. And Samuel is an IT backup for us. He's doing all the IT work behind the scenes, and he's joining all the way from Ghana. So we have quite a mix of people from different places, at least 3 countries at the moment. And I understand there are a few people on Facebook as well who may be joining from various places. So I'm really grateful to all of you for making time to join this book launch, and everyone who's here who has taken time to join us, to take some of your precious time to join us. I'm really grateful. If we go to the first slide, the Slido one. Okay, so can everyone just type in slido.com on your phone, please, if you don't mind. Just type in slido.com or just scan the QR code. I'll just give a minute for everyone to do that. And then okay, yeah. So just a second. Just a second, please. Okay, so if you type in that code into the Slido, so if you type slido.com, you see that there's a space at the top that says type in code. So type in that code on the screen, please. I'll give a few seconds for people to type that in. So I'm waiting for people to join the poll. Yeah, I can see people joining now. Yes, more people to join. Yeah, so just slido.com and type in the code. It will just connect you. Yeah, please join. Okay. There's still a few people who I think have not joined yet. So just slido.com and the space at the top, just put in that code 3871703. Just put it in it. Or just scan the QR code. It will just take you to that page. And I'm going to start the quiz in a few minutes. So it's a quiz about the NHS. Few questions that kind of test our knowledge about the NHS and things that happen in the NHS. I'll give a minute and then I'll just start the quiz. Okay, so I think I'm going to start the quiz now. So so I'll just start the quiz and you only have 20 seconds to answer the question on your screen. The first question is, the UK NHS has more hospital beds now than at inception. Okay, so the correct answer is no. And I'll show you the leadership board. So yeah, let's go to the next question. So the UK has a high doctor-patient ratio when compared to like countries, yes or no? Okay, majority of you said no, and it is the correct answer. All right, so Kingsley and Mike, you are doing well. You are the leadership, you are the top. So next question. The NHS has a high administrative cost compared to like countries. So majority of you say yes. Okay, so actually it's no. I know that is something that most people think, but it's actually no. Okay, next question. How much does it cost to see a GP? And I mean here in the UK. Okay. All right. So it's £42. Majority of you thought it would be 90 or 320. And Kingsley, you're doing well. You're at the top. Pastor Benning and then Mike, you are also there. Okay, next question. How much does missed appointments cost NHS England in a year? Okay, so this is interesting. Half of you think that is £10 million. And let's see the answer. So it's actually over £200 million. That's how much it costs the NHS in England for missed appointments. Okay, so next question. What percentage does the NHS spend on the private sector? Okay, so 44% of you think 26%, and then 22% of you think 7% and 15%, which is quite interesting. So I would say 7 and 26%. And it depends on what you are looking at, but people think that 7% is often the quoted figure, but people think that's actually more than that. It's about 26%. Okay, so I'm going to finish the quiz, and Kingsley, so if I look at the poll results, I think Kingsley, you did quite well there. With four, yeah, you did quite well with 4 out of 7 questions. So that was good. So you need an award. Thank you. Okay, so I think this quiz was just to test some of the perceptions and knowledge that we have about the NHS, which I think kind of puts a few things in perspective. So the next time you miss an NHS appointment, remember that you are part of the over 200 million pounds lost to the NHS in England alone. And this was even in 2019. It may even be far more than that now. So I think that's for some perspective. Okay, so if we go on to the other slides. Yeah, and the next one. After the acknowledgements. Sorry, just a second. Okay, yeah. So again, thank you for joining. I know a few people have joined as well. I'm really grateful for taking your time to join. Dr. Story, it's good to see you. There are also a few people on Facebook as well, and we have people joining from the United States. Justice, good to see you. He's a professor in the United States. He's a colleague from medical school as well. We have people from Ghana and from the UK as well. And Sean is a tennis colleague. Thanks for joining, Sean. Thank you. So we already know the book and the title, Healing the NHS, a Physician's View for Change. And one of the questions I always get is, why did I write the book? I think I'm someone who's very interested in continuous improvement, especially in healthcare delivery. And I'm quite passionate about it. And the reason is that I've experienced challenges in healthcare provision myself as a patient. I've seen family members and friends experience healthcare challenges. And I also see our patients go through, things. So that brings that passion in me. And there are several patient stories that I can share from my previous experience in Ghana, which made me write my first book last year, which was the no bed syndrome. And that was because a family member of mine was very ill. In fact, critically ill, and we could not get an emergency bed for the person. And so all of this is in the interest of everyone for healthcare delivery to improve. So that's one of the main reasons. And also I share personal experiences. And in the book, you read about experiences that other people have. I remember recently speaking with someone who works in the NHS. She has some back pain, and she's not getting the appointment, and she's now going back to Nigeria to seek healthcare. And I'm hearing more and more of such stories. People are going to different places to seek healthcare because of the waiting list and all of that. I even read in the newspaper a Ukrainian who had to go all the way to Ukraine actually in a war-torn part of Ukraine to have a dentist appointment. So these are some of the stories that I look at, and I try to share some experiences. But I must say that the NHS is not a bad institution. It's still one of the best healthcare systems in the world. Like everything that has human beings and systems, there are always challenges, and you always strive to improve. So that is exactly what we are trying to do here. And like Kingsley said, those in the United States will say the NHS is like top notch, and that's what they want, and they strive for. And those of us here also feel differently, because when you are in it, it actually feels different. So that tells you how healthcare systems are. I also have different ideas about how things can be done. And I share experiences about that as well, and things that I've had different ideas, which have also helped in healthcare provision. And at the end of the day, we all want the NHS to be better. So I'll go on to the next slide. Okay, I initially wanted to just have a few quotes from the introduction part of the book, but I've decided to actually read the whole introduction to all of you. So you are privileged to hear the introduction of this book, and it's not that long, so I will just read it as it is verbatim. So I'm a Ghanaian trained doctor who worked in Ghana for almost 10 years before joining the National Health Service in the United Kingdom. I spent most of my working time in the rural areas of Ghana and eventually rose to the level of a senior physician specialist. I've worked in the private and public sectors in Ghana and did previously run my own health facilities in Ghana. Improvement in healthcare delivery is a passion of mine. I've worked across various roles since 2017 in my hospital in England. I initially spent a few weeks as a foundation year doctor, which I've qualified as a newly qualified doctor, before working as a medical registrar, which I've qualified as trained to be a consultant. I've also worked as a specialty doctor, acting consultant in geriatrics, then as a specialist in geriatrics. This has allowed me to see how the NHS works from a clinician's point of view across various levels of clinical work. I've also undertaken courses that have deepened my understanding of how the NHS works. I've only worked in one district hospital in England, and I've not worked in any of the different countries of the UK. However, the issues are the same in the other countries of the UK. I've addressed this limitation by doing a lot of research on the various topics and referencing them. This book brings a lot of evidence-based discussions to the various topics. My experience working in NHS England has been largely positive. This has been a good opportunity, as Ghana's health service is largely modeled after the UK's NHS, with the goal of achieving free healthcare at the point of need. In 1948, the NHS became the first health system that offered free healthcare at the point of need. It performed the first liver transplant in Europe, as well as the world's first CT scan and in vitro fertilization. The NHS celebrated its time anniversary on the 5th of July 2023. The NHS is one of the social interventions revered the most by the British people, and it's always one of the key topics during an election. The UK NHS is the 5th biggest employer in the world, employing 1.7 million workers in the UK. The UK NHS also sees 1 million patients every 36 hours. The only UK government expenditure above that of the NHS is welfare. A survey by two prominent UK think tanks, the King's Fund and Northfield Trust, looked at the British public's sentiments towards the NHS. There is public goodwill towards the UK NHS, with 62% of respondents in that survey saying that the NHS make them most proud to be British. The survey also showed most British people want the NHS to be accessible and free. 94% of British respondents agree that healthcare should be free, whilst 84% want healthcare to be available to everyone. I remember having a conversation with a colleague who told me some patient stories that highlighted all the positive sides of the NHS and some of the challenges it faces. They did a life-saving intervention on a patient, which an audit showed would have cost hundreds of thousands of pounds. Amazingly, this patient had this life-saving intervention and walked out of an NHS trust without paying a dime. He also told the story of a British citizen living in the United States of America who relocated to the UK because he needed a huge amount of money for a medical procedure there. He moved to the UK to have this procedure at no cost whatsoever. Medical tourism is one of the challenges the UK NHS faces, as people can access healthcare without paying the due tax. These everyday stories and experiences are what endear the NHS to people in the UK. I have taken advantage of my NHS experience to study a health system that was arguably the best in the world. However, the NHS has faced several challenges in recent years. Accessibility is becoming a challenge, and several years of underfunding has shaken the foundations of the NHS. Some of the areas that need to improve are health outcomes, cancer care, and mental health provision. The coronavirus 2019 pandemic placed further strain on the NHS. I wrote a book in 2022 titled A Developing Country's Health System Challenges, Addressing Ghana's No Bed Syndrome. This book was largely a reflection of my previous experiences across Ghana and the UK vis-a-vis best practices in healthcare provision. This book sought to address Ghana's health system challenges and proffer solutions to the age-long no bed syndrome in Ghana. I would define the no bed syndrome as the lack of an appropriately resourced hospital bed staffed by an appropriately skilled health worker. I came up with these 8 issues as the main challenges faced by Ghana's health sector. 1, health financing. 2, structure of the health management system. 3, healthcare infrastructure and information technology. 4, human resource development. 5, emergency systems. 6, public health focus on disease prevention and community care. 7, public pride and goodwill towards Ghana's National Health Insurance Authority. 8, patient empowerment. Having worked in the UK for the past 7 years, these same issues are faced by the UK and other developed nations. The only difference is the magnitude of the problems and the nature of the solutions required. The UK also faces an aging population with attendant healthcare requirements. Why have I felt the need to write this book? There is a saying in my language that the one who reads the path does not always see that it is crooked. To wits, observers sometimes see wrongs which are not obvious to those involved in an activity. I believe my few years in the NHS and my outside experience mean I see things from a different lens. An example of this is a quality improvement project I did at the Harrogate District Hospital on medical registrar bleep numbers, which were outrageously high when I started to work there. This was hitherto the norm. This quality improvement project contributed towards the use of the ASCOR mobile device and the single point of access as referral tools for acute medicine admissions. This has improved the acute medicine referral processes in the hospital. There is a need for NHS workers who are on the ground to share their experiences and find their voice in the debate about a fit-to-purpose NHS. Politicians alone should not shape the narrative. The most important thing the NHS needs to do is to work efficiently and for NHS workers and the public to design and implement locally grown solutions that will facilitate this. the future NHS should be patient-focused, efficient, provide a great working environment, and free at the point of care. So that is my introduction. Next slide. So the book has 14 chapters. I've read the whole introduction to you, so you are the very lucky people. I also have other chapters. I also talk about the best healthcare systems in the world, in the developed world. I talk about the history of the UK NHS, when it started on the 5th of July, 1948. I also talk about the structure of the NHS, NHS England. I talk about challenges faced by the NHS, and I talk about waiting lists. I talk about staff shortages. I talk about finance, which is probably the elephant in the room. I talk about waste and other things. I also talk about the global demand for health professionals. Data shows that the US, for instance, where Kingsley and Justice are joining from, will have almost 500,000 deficits in healthcare professionals in the next few years. So it's a global issue. I also talk about bureaucracy, and there's a picture in the book of Dr. Gordon Caldwell, who has been an NHS consultant for many years. And I want to acknowledge him for allowing me to use that picture in the book. I sought permission. And he has a picture of him lying on the floor with about 30-something pages of admission sheets lying by him, which were the forms a nurse has to fill to admit one patient. And he mentioned that these long bureaucratic processes have been transferred to even more inefficient computer systems. And I know that is something he is passionate about as well. Next slide. I also talk about local or temporary staff and the money spent there. The NHS England spent about £6 billion, I think in 2021 or 2022, on bank, so staff picking up shifts that are there, and £3 billion on local. So there's a lot of money being spent on temporary staff and local. I also talk about the competitiveness of salaries of UK doctors, and we know this is an issue with strikes going on and all of that. I make the case that there is a global demand for health professionals. The salary of UK doctors fall outside the top 15 in the world, and we need to make the salaries competitive. Otherwise, we are digging a bigger hole for ourselves. I also talk about public health, and we've all experienced COVID, and we know what we all went through. So I talk about COVID. I talk about what happened during COVID, committees that we know there's a public inquiry. So public health is one big issue that the UK NHS obviously has to concentrate on. And I mentioned that in all my 7 years in the UK, I've only met one clinician who wanted to be a public health physician, which was quite strange to me because coming from Ghana, we have quite a lot of clinicians who are public health experts. And people think that played a big part in the UK's response to the COVID-19 pandemic and the challenges it faced, that there were not enough clinician experts at the top. I also talk about eliminating wastes, and I share my own personal experience that I try to record on a day. One day I just decided to write how much time I spent on the computer just going through patient records before I see a patient. And I was surprised to see that 70% of my time was spent on the computer, not seeing a patient, which is not what what would be the best use of my time. And this is not specific to any hospital; it's a general problem. So Dr. Gordon Caldwell, for instance, mentions that data shows that nurses spend 50% of their time filling these documents, and some believe that it's now about 70%. So more and more doctors and nurses are needed because I think there's a lot of waste and we are not working efficiently. And I strongly believe that no amount of doctors or nurses can fill that gap if we don't find the means to work more efficiently. And of course, I also talk about waste in terms of things that we throw away in the hospitals, disposables, and how to find ways not to, waste things like that, because it's all public funds that have been put in. I also talk about some government interventions. The government's 2019 recovery plan. I talk about the virtual ward that the government has taken quite a lot on. I also talk about the new workforce plan and what has become of some of these interventions. And of course, the elephant in the room is health financing. Some people argue that the UK cannot continue to fund the NHS in the way and manner it is funded now. And I share new ideas on some other ways to finance the NHS. I talk about health financing in the United States in the book, health financing in Australia, health financing in Norway, health financing in the UK. And I put in a bit of health financing from Singapore. I reference that in the book as well. And of course, I go to prescriptions for the NHS. And on that score, I talk about some of these ideas. So looking at staff issues, and that brings to mind a friend that I speak with. She's a nursing student. She's very committed. She's doing all the best she can. She's learning, she's sacrificing and all of that. And sometimes finding it hard to pay her fees because it's quite expensive and she doesn't get the support she needs. So I was actually a bit baffled that we say we need nurses, but actually those who are there and doing some of these programs are not being supported financially to even finish their programs. And I do mention that they can be supported, they can sign a bond so that they serve the NHS for a number of years after completion, so that whatever money is put in them comes back to the society because they will work in the NHS. So those are some other ideas. And of course, I conclude and just sum up all these things that I've mentioned now. I'll go to the next paragraph. And I'll end here by quoting Anurin Bevan. I believe he was what we will call the Secretary of State for Health and Social Care. Then in 1948, at the inception of the NHS, and this quote is in the Lancet. He said, on 5 July, we start together the new National Health Service. It has not had an altogether trouble-free gestation. There have been understandable anxieties, inevitable in so great a noble an undertaking. Nor will there be overnight any miraculous removal of our more serious shortages of nurses and others, and modern replant buildings and equipment. But the sooner we start, the sooner we can try to see these things and secure the improvements we all want. My job is to give you all the facilities, resources, and help I can, and then to leave you alone as professional men and women to use your skills and judgment without hindrance. Let us try to develop that partnership from now on. And I think this quote is interesting. This is almost 76 years ago, but I would argue it's the same issues now. He talks about serious shortages of nurses and others, which will include doctors and other health professionals, and modern replant buildings, which is an issue. Was when I did the quiz, you remember there was a question about, did the NHS have more hospital beds at inception than now? And the answer was no, because the NHS had about 280,000 hospital beds at inception. It now has about 140,000 hospital beds and 140,000 hospital beds. So there are shortages of buildings and beds, hospital beds, and equipment. And he answered that by saying this is a partnership, which is exactly what I think the book is seeking to achieve, which is that we all need to contribute our quota. And in the book, I make the case that those on the ground as NHS workers have a duty to seek improvements wherever they work. We need to seek to work more efficiently, of course, with the patient as the focus of everything we do. And what the public can also do, I also share some financing options which the public will need to buy into. I also share, of course, that will mean we will need the policymakers to agree and enact laws and things that will get this done. So it's a partnership where everyone has a duty and has a role to play. And I believe this book needs to be read by everyone in the UK because it's all part of building that partnership, sharing ideas, discussions, and finding the way forward. And I also share another idea that I think we can use to get more consultants. Okay. Yeah, the next. I think if I have to use one sentence to sum up everything, I would say the NHS needs to work more efficiently. No amount of money, no amount of health professionals, just dumping it in will solve the issue. Because if I spend 70% of my time on the computer and not seeing a patient, and nurses have to fill so many forms before they admit a patient, of course there will be delays. Of course there will be a waiting list. Of course you cannot see as many people as you want. And of course you need more health professionals. So we have to find a means to work more efficiently. That would be a small sentence to summarize everything. Thank you.
All right, Dr. Norman, thank you very much. That is very detailed, especially considering the fact that there are 14 chapters, but you've been able to compress all of that into your presentation. It was very insightful, and to me, it rather gingers me to get a copy of the book and then get to read it. Permit me to beg to differ with you on one point that you made. You, at the concluding part of your presentation, you said that this is a book that everybody in the UK needs to get a copy of and read. I beg to differ on that. I would say that with the global world that we find ourselves in and the learnings that we can get from wherever in the world, it's imperative that irrespective of where you find yourself, please get a copy of this book because most of the problems that he made mention of are inherent in the health systems of most countries across the world. So I know that if we could all go ahead and learn from it, grab a copy of it, it will be very helpful. And you never know, you may as well find yourself in the UK and may have a need for the NHS. So I highly recommend that each and every one of us get a copy. So that is a good segue into, the book. We trying to sell a few copies here, but then I would like to go ahead and then have us display the QR code. Okay, wow, that's already been displayed out there. So for the next 5 minutes, I'm going to go ahead and then highly recommend that we all pull our phones and access the QR code. It's on Amazon. And then let's go ahead and purchase a copy of the book. You all can attest to the fact that this is a book that is very insightful. It talks about his personal experiences, from Ghana, Dr. Norman's personal experiences in UK, and then also some experiences of patients as well. So let's go ahead and take 5 minutes, scan the QR code, and let's get some copies. And I had a chance to take a look at it. It's not even expensive. So it tells me that this is not a book that Dr. Norman is looking at it from a perspective of profiteering, but rather sharing the knowledge and then also making sure that his passion for continuous improvement becomes a reality. So I think I saw one on Amazon for $13, which I think is considerably cheaper. Um, if you take a look at the wealth of knowledge that is being embedded into the book and how much it could be of benefit to each and every one of us. So let's give ourselves about 5 minutes. I think it's 10 50 pounds. Okay. So 10 pounds and 50 pence. So in the UK, and then in out here in the US, I think it's like $13. So I highly encourage you, please take your phones, access the QR code, and then let's get a copy. Um, we'll give ourselves about 5 minutes whilst we go through that. I think we currently do have 16 people, including the author, as part of the launch. So at the barest minimum, not considering those on Facebook, we should be able to get 16 books purchased within the next 5 minutes. So, Dr. Norman, are we able to get any data on how many books have been purchased, or that is not an information that we can get? All right. So there's also a link in the text chat. If for any reason the QR code is not working, you can access the link from the text chat. Yeah, I think you're going to go ahead and answer my question.
Not at the moment, Kingsley, but I'm sure we can share that later. Thank you.
Okay. All right. So we're going to go ahead and then give ourselves like 5 minutes. Whilst we take our time, we have two different options to go ahead and access the book purchase. So the first one is the QR code. And then alternatively, we can also go ahead and then use the link that has been embedded in the text chat. So we have just about 3 minutes, and then we can go ahead and proceed with the next thing on the agenda. So I'm just going to do a countdown, 3 more minutes to go. Take your time. Knowledge is power. It may not be of benefit to yourself, but I bet you each and every one of us has friends and family that are in the health sector that the book could be of benefit to them. Not only is it talking about the NHS, but then also talking about some improvements that health practitioners themselves can also make. And one thing that really resonated so well with me was, how much time doctors spend on their computers as opposed to the time that they should be spending on their patients, which is something that I think if a drastic change can be made to, it will go a long way to improve our healthcare delivery systems wherever we find ourselves. So we have about 2 more minutes to go, and then we can proceed with the next steps of the program. Well, Norman, whilst we are on this, Dr. Norman, whilst we are on this, so you made mention that you need to find a prize for me for winning the quiz, right? So with your specialty being in geriatrics, at what age do we consider somebody a geriatric patient? I just want to ask a quick question before I tell you the prize that I need.
Oh, that's a tricky question. The WHO says 60 years, but it depends on where you are. In Ghana, it's 60, but in the more developed world, it's about 65 and above. And I'm sure this will change with time as people live longer and longer. And in terms of terminology, some people prefer to be called senior citizens or older people. So there's a lot of things around that, but generally 60 and above, I would say.
Oh, okay, so 60 and above. So there's some relativity to it, right? Okay, all right. So to talk to you about my prize, I know that with the advent of COVID, there's this new medical practice that is out there, telemedicine or virtual medicine. So immediately I do turn 60, you're going to be my remote doctor. That's my prize.
No problem.
All right, folks. So we've exhausted our time for the book purchase. We have our 5 minutes, and I have a strong conviction that each and every one of you took time and went ahead and purchased the copy for yourself. If for any reason you were not able to do so, um, we will find a way to make the links available so that in due course you can go ahead and get yourself a copy. And then if you have any beloved individual that you think could also benefit from the book, I highly encourage you to go ahead and do that. And then also we may have some of us that have kids, friends, and relatives that are aspiring to be health practitioners. So these are all gifts that we can give out to friends and family to help support the passion that they are pursuing. So we went ahead and talked about the fact that this book is not going to be a one-sided book. It's not going to be just Dr. Norman's perspective, but then also we get perspective from other practitioners, and then also perspective from patients that have used the NHS system recently. So, ladies and gentlemen, it's my pleasure to go ahead and then kick off our panel discussion, which is going to take us about maybe 20 minutes or so that we can get divergent thoughts. We're going to open the floor for questions. If for any reason you'd love to speak up and ask a question, I highly encourage you to raise your hands virtually, or alternatively, you can also go ahead and type your questions into the text chat, and then I can go ahead and read it. So we'll go ahead and then invite our panel onto the screen. So like I made mention of, we do have Dr. Ober, who is doubling as our chairman. And then also we have Dr. Jim Story, who is a consultant in acute medicine. And then also we have I'm so sorry, I think Mike, right? Yes, we also have Mike, who is a patient that recently used the NHS system. We'll have them share their perspectives with us, and then we'll go ahead and then also ask some questions. So without much ado, I'll go ahead and then hand the floor to Dr. Story to share his experience with the NHS with us in reference to the book, and then also some of suggestions that he may have. So before we go ahead with that, I think some of you, initially I did read a bio of Dr. Story, but you were not here. So I'll crave the indulgence of the others to go ahead and then read it again so that we can get to see, the expertise that Dr. Story brings to the table. So as you can see on the screen, Dr. James Story grew up in the North Wales coast before moving to Leeds in Yorkshire, where he studied medicine at the University of Leeds, and he graduated in 2001. His medical career has seen him work in various hospitals, and this includes the West and North of Yorkshire, in addition to an OOPE year in South Australia before he completed his training in acute medicine and being appointed as a consultant acute physician at the Leeds Teaching Hospital in 2012. So considering that, you can get to see that he has about 12 years of experience as an acute physician. His areas of interest or expertise are utilizing stimulation methodology, specifically focusing on the importance of non-technical skills or human factors in healthcare delivery to improve quality of care, patient safety, and the training of other doctors and AHP clinicians of the future. So without much ado, Dr. Story, the floor is yours. Sam, is there any way we can move on to the others?
I think we can
And I
hear
think
this. Dr. Story, I think your audio is, your volume is muted.
it's muted. Okay. Well, whilst we fix that, let me. Okay, I think he's up and running.
Still don't think you can hear me. No.
Yes, we can hear you now.
Sorry about that. I don't know what quite was happening. So yeah, sorry. Thank you for the introduction, and thank you for inviting me, Dartel. I've read the book, so I have one of the first copies here. So yeah, I'm open to any questions, and I can steer this conversation in any different direction as people want. I think Dartel and I share an office together in Harrogate, so I moved from my position in Leeds, which is about 15, 20 miles down the road, to Harrogate, just celebrating my 3-year anniversary. So I've been working here and shared an office with Dartel for most of that time. And we'll sort of generally riff on similar subjects about improvements in the NHS, whether it's about efficiency, whether it's about cost, and comparing it to all different healthcare models out there. So what I think I could bring to this is someone who, thankfully, I've used the NHS more as an employee rather than someone who's thankfully used it on the other side. But certainly, I've had all my loved ones benefit from the input of the NHS. And as Dartel said, there's some good aspects to that. There's always room for improvement, and which we're constantly striving to do. So I'm happy to sort of leave it a couple of minutes before I start talking about anything which I think is relevant. But yeah, any questions about anything whatsoever about my experience or what I can bring to this discussion, I'm happy to face any questions.
All right, Dr. Story, thank you very much. And I think as the MC, I would use my discretion and get to ask the first question. So, when it comes to acute medicine, right, it's very critical, right? This is a point of life and death, and this is an area where I would say that there's not much room for delay or much room for error. So if you were to juxtapose that against, the normal NHS system where, it's like seeing a doctor for a routine check, right? The problems that Dr. Norman highlighted, how prevalent are they when it comes to acute medicine? And what are your suggestions?
Yeah, I think it's a very, very good question. So thank you for asking that. I think whilst I may have come into acute medicine and had the belief that it was all high octane, dealing with sepsis, dealing with very critical decisions, I think increasingly in my line of work, and I suspect that's rippled throughout the whole NHS, certainly in secondary care, is a lot of the slightly subacute issues which have been left to fester, then denied by access to timely primary care. In terms of what I address in acute medicine is broadly, my specialty is split into 3. And I would class that as the patients where they remain under my care for that first 24, 48 hours, where I can either diagnose and treat and discharge or investigate and reassure people from a brief hospital stay so I can complete their whole care episode under my care. There's also about a third of those where my index review in that first 24 hours will recognize either through history and examination or through investigation the need for that person to see an ongoing specialist, for example, a cardiologist or a hepatologist. Now, that may well be to remain in the hospital under that colleague's care or to be followed up by that person as an outpatient. And I think broadly, there's another third of my patients, which is an increasing and expanding area of the NHS, which is that same day emergency care, which is, a bit of a misnomer really, because it's usually within 24 hours, where either a patient presenting through our emergency departments or through our GP can access timely expertise and investigation within secondary care environment. Now, these are specifically people who would benefit from timely investigation or treatment, but who don't necessarily need hospital admission. Now, I quote this figure because we know from various studies, and it's repeated all over the globe really, that approximately 10% of patients that spend more than 24 hours in hospital will suffer some harm in some form or another. Now, that might be severe harm, such as falls and a subsequent fracture, or a hospital-acquired infection, or it might be something minor, like a delay in the administration of their Parkinson's medication, or delay in administration of their anti-seizure medication, which can either have a comorbid effect or in some instances even a mortality effect. So that actually staying in hospital whilst perceived as to be a safe haven is actually not a safe place. So I'm very clear that if you need to be in hospital, whether that's to have an operation or to have a level of care or observation or investigation that can't be done with you out of hospital, that's what we should be using our hospital beds for. Now, as Dartel said, we've got 50% fewer beds than we did 50, 60, 70 years ago. Whereas I think it was falling commonplace that people would be admitted to hospital to get everything kind of sorted. And we know that as well as those infections, as we have an aging population, if you have an aging population, it can increase the risk of delirium, it can increase the risk of deconditioning and all the knock-on effects of there. So my job is through all those 3 different facets of my area of specialty is to recognize with reasoned risk and faced with constant diagnostic uncertainty, which patients require to remain in hospital and which patients can be followed up or investigated out of hospital, either through myself or through specialist colleagues. I think the difficulty we're facing at this sort of moment in history now is the access to primary care in the NHS is more and more challenging, and it's presumably very, very complicated as to why that is. But it's, broadly, there's not enough. There's an over demand for the service that's available to cope with, and also because part of that is we're having an aging population. So people are not dying of heart attacks in their 60s. They're not dying as much of lung cancer in their 70s. They're not dying of big strokes in their early 80s. They're all living longer, which is what we want. It's what we strive for in healthcare. But that comes on with some knock-on effects, where with frailty, with deconditioning, and very, very, complex social care problems, which is very expensive. Now we have a culture in the UK where we're probably less in terms of community-based than we were probably 70 years ago. So this aspect that parents and children and families, they become separated. There's social climbing, there's people moving around the country rather than staying at home. So actually there's a lot of people that are left living on their own with frailty, with family that are not around them, and they demand care. And currently one of the big problems is up to some occasions 40% of our hospital beds are full with people not needing a test, not needing a treatment, not needing an operation, but needing secure and safe placement out of hospital. Now, this sort of bleeds more into what Dr. Norman is in his specialist area. But what we're sort of struggling with at the moment is recognizing the people that need to be in hospital and recognizing the people where their care would be best delivered out of hospital. Now, you mentioned right at the beginning of your question, risk. Now, it feels as though if I would be able to prescribe many drugs and my number needed to treat was just 1 in 10, that would be a very, very powerful medication that drug reps would be climbing all over us to prescribe that drug, whereas mine is to prescribe them not being in hospital. But increasingly, we've got to balance that with all the other issues that we're dealing with. And as I say, I think there's a lot of that, which is there's gaps in Dartel's book about nursing care, medical care, funds, access, but also efficiencies. So I suppose that's a very, very long answer to a very short question, but it's about, I think we rise to the challenge. It's just becoming increasingly difficult to sort of square those off without somewhere along the line things happening, be that such a delay in getting all this sorted that you find some people will walk into hospital and they'll be discharged to a nursing home And that's not because of necessarily what they presented with, but because of the time it's taken to get through all of that sort of bureaucratic quagmire, and all the while they're getting deconditioned and everything else like that. So, yeah, I suppose that's I don't know if that's even answered your question, but it's basically all the things that are running through my head when I'm assessing lots of patients in my line of work at the moment.
All right, Dr. Sorry. Thank you very much. Well, ladies and gentlemen, I would love to be very cognizant of our time and respect your time. So what I'll do is that I'll go ahead and reintroduce the other two on our panel, and then we'll get their perspective, and then we can open the floor for some questions, just so that we can be respectful of your time and not go overboard. So, in addition to Dr. Story, we also have the privilege of our chairperson of the book launch, also Dublin as a panelist, and his name is Dr. Ogba Omuchekwa. And I was also prompted to the fact that he's a chief back in Nigeria. So, not only is he a doctor, but then he's also a community leader. So Dr. Ogba is a consultant liaison psychiatrist based at the Scarborough General Hospital. He obtained his primary medical degree from the Abia State University back in Nigeria in 1999. 1999, Norman, Dr. Norman, you had just graduated from high school, right? If my memory serves me right. So Dr. Ogba is also a member of the Royal College of Psychiatrists and a diplomat member of the Royal College of Obstetrics and Gynecology. He also has a master's degree in public health from the prestigious University of Aberdeen, Scotland, and he's worked in several NHS hospitals since 2008, both in Scotland and England. So, ladies and gentlemen, once again, I'm Dr. Ogba, and I'll go ahead and proceed with the introduction of our patient, who is going to be part of our panelists. And then we can go ahead and pose some questions after they share their own perspectives also with us in reference to the book. So we are also privileged to have Mike Aspen, who is a patient, and he has an experience or a story which is quite recent, which makes it very easy to put it into perspective of how the NHS is doing, how great it is, and some of the challenges that it could be compelled with. So Mike is a 46-year-old husband. He has an angelic son and then two teenage daughters. And Mike recently had a heart attack in January 2024, which happened to be a three-vessel disease. So just to go through briefly, you can all see it on the screen. Mike had two stents fitted through his wrist after unstable angina development in the end of February 2024. A further two stents were fitted, plus the original two expanded through both wrists. So generally, he's recovering well, though there's been some speech difficulties intermittently. So Mike professionally is a QA test analyst with a large management software house for the past 15 years. So ladies and gentlemen, Mike Aspen. So I'll go ahead and then pass the mic to Dr. Ogba for some few perspectives of his from his experience with the NHS, and then also we hear from Mr. Aspen, and then we'll open the floor for some questions, just so we can be respectful of your time.
Yeah, thanks, MC Kingsley, for introducing me again. And thanks to everybody for, to all the audience present. When James was talking about his experiences, in terms of geriatrics, in the fact that people are living old, living longer. That kind of ties into the kind of job I do at the moment. So I'm a liaison psychiatrist, and I look after people who are admitted into hospital from the age of about 18 years to the elderly age, so from 16 and above as well. And you find that mental health, people's mental health is it's quite topical. People are having difficulties, and this can be due to a lot of factors. Let's talk about the elderly population. The rate of people developing Alzheimer's dementia or any of the other types of dementia. You find that people living longer, people are with people living longer, you find that the risk of developing one form of cognitive impairment or the other increases as well. And then when you talk about people staying in hospital because of social care difficulties, and people have families that they have work, they have to go to work, they won't be able to spend more time looking after their elderly either parents or relatives. So you find that people are spending more time in hospitals. And of course, when you talk about the challenges in mental health, you find that a lot of spaces in terms of staffing shortages. You have so many advertised consultant positions, nobody's filling them up, even nurses. And then that means that the few people who are remaining in the service, they're having to work harder. And then you find that people having caseloads of up to 80. So how possible will it be for a nurse who is a care coordinator to be able to look after 80 people with different mental health difficulties? You find that that person will invariably break down themselves, and then the circle continues even further. When you talk about the shortages as well, in order to plug these gaps, you don't have a choice but to use agency staff. Very good. However, that also poses its own challenges because you need continuity in care for people. And this is most important in mental for you to care for someone with mental health difficulties, developing rapport, developing trust is very, very important. When you're having to change different staff, find that is broken. And that also has its own difficulties because these patients may become more distressed. And just imagine you see you see a staff and you're trying to develop rapport with them, and then next time I person is absent. So this is kind of contributing as well into the difficulties that we're experiencing in the NHS. And then of course you talk about when Dr. Man was talking about was doing the quiz in terms of the bed spaces. Yes, we are having more large hospitals. Like let's talk about Harrogate. So in Harrogate, we used to have the Briery Wing. However, at the moment, we don't have any 136 suite in Harrogate. The Briery Wing in Harrogate was closed, and then we have a bigger hospital in York, First Park Hospital. However, the one in Nantarleton was also short. So you have bigger hospitals, but comparatively, when you compare the number of bed spaces, you find that actually the number of bed spaces is even less. And then you have the problem of sending people out of area. Somebody might be living in Harrogate, and then there's a bed. A bed may be located for them in Middlesbrough or Scarborough, as the case may be. So it is difficult, and these are also challenges. Um, when you need people's loved ones to be able to visit locally, and they're unable to do that, people are being taken to faraway places, and that is a problem. So I mean, we can go on and on and on to talk about the difficulties, but the good thing is that the people who are in the system are quite dedicated. People are going out of their way to make sure that they try as much as possible to keep plugging the gaps, But then, how long would they continue to do that? You know, so there is serious need in the NHS, and this needs is in different areas. mental health is very, and yeah, so these are just some of the, I mean, that I can talk and talk and talk for, for the entire, for hours and on end. So I'll just keep quiet, and then maybe as questions come up, I'll be able to respond. Thank you.
Absolutely. So that boldly tells me that the topic is in, like, you can't exhaust it. Like you made mention of, you could talk and talk and talk, and by the time you realize we've launched another book as part of the book launch, right? All right, good. All right, so ladies and gentlemen, let's go ahead and then hear from Mike. Let's have Mike share a few perspectives with us, what his personal experiences have been, some of the challenges, and then even some of the success stories. And then from there on, we'll go ahead and then open the floor for some questions. And like I made mention of, you can virtually raise your hands, or you can also go ahead and type your questions into text chat, and I'll be more than grateful to go ahead and read it. So before we get Mike on the floor, there's a request by Dr. Norman, which I think I would love to prompt each and every one of you. So at the tail end of the book launch, he would love for us to all display our faces, and then we could take a picture of the participants. So if if you're a lady and you need to touch up a little bit, or if you're a gentleman and your camera is not on, you may want to fix your shirt or maybe brush your hair a little bit. So that's just a heads up, right? Right, Dr. Ogba, I have a comment. I'll pass that comment at the tail end of it. So, Mike, let's go ahead and then hear from you.
Hi there, Kingsley. Thank you very much. Can you hear me okay, Kingsley?
Yes, we can hear you. We can hear you loud and clear, and thank you very
Fab-
much.
Fabulous. I've got a little bit of a speech difficulty, so every now and again it pauses. So unfortunately, it might not be your connection, and it might be my voice. But I didn't tell Dartel that my most recent experience with the NHS was actually this Wednesday, because I had tried to go through to primary care at my GP practice, because I've had friends that haven't seen me for a long time, and that are health professionals, and basically they just jumped on the bandwagon with me to push me to get out. So this Wednesday I'd actually phoned my GP practice, and I must have had hot fingers because I was number one in the queue at 8 o'clock for the practice. And basically, because Wednesday my voice was particularly bad, after speaking with the receptionist, I then had one of their own paramedics phone me, and basically advised me to phone 999 with how severe I was presenting, to check if it was a situation. So good that I was able to make my way to the hospital myself, and good that, like, my own way to the hospital when I was having my heart in January. Myself and Dantel left the hospital in Harrogate, and the experience Wednesday was exactly the same as my January experiences, whereby as soon as I presented at the front desk, it was as if you get with the way system, and I was very taken to first badge room on all 3 occasions, and back in January, it's all about people within this service. My wife is healthcare as well, and when we'd gone to the second triage room, Beth had just given her opinion that for me to have an ECG before bloods, and basically the nurse obliged, and that basically showed that I was having an active heart attack at that particular point, and because it was at handover time early in the morning, basically she just asked us not to move and just ran off, and that was the kind of start of that journey. But I I can't knock the acute services that I've had personally. The NHS has saved my life twice from having bacterial meningitis as a toddler. I think what both situations has highlighted to me is that you have to basically, if somebody isn't listening to you as a health professional, because the majority of the skills are listening and actually doing something with that information. When I obviously when I was a toddler, it's all that I've been told, but it was on the third when I presented on the third at A&E, and at that point I was unconscious. It was some the quality doctor helped life with it was wholly preventable. I had suffered from high cholesterol for a number of years, and also I come from both sides. I suffer from cardiac issues early on, as in all of my way in the 40s early, and I trials for my cholesterol as only as reached October last year, but the referrals were not back. And I've spent 2 sessions in the hospital, see, and not a white colleague, but other specialties. Everybody, especially what we alluded to with aging population, very time on wards self being on that 45, and around you is the late 90s, and
Hey, Mike.
Yeah.
So we have just about 5 minutes. So, like I made mention of, I would love for us to be very respectful of our time, and great insights. I'm picking so many things from what you are sharing. Even talking about the fact that your recent experience with the NHS was just this last Wednesday, right? And how grateful that you are to the NHS, that irrespective of the challenges, they've saved your life twice. You also talked about, your wife being a healthcare practitioner herself, and then also that aspect of you having cardiac issues cutting across your family. So I think I would love for us to use the last 5 minutes to give the audience the chance to ask some questions, and then most likely we may be able to bring you back to answer some of the questions for us. So prior to Mike getting on, I think I saw a hand raised, but then it went down. So please, if you have any questions, then you could raise your hand, or if for convenience sake you would love to type it into text chat, I can go ahead and read it. So I do have a question here. It comes from D. I don't have the full name, but then I'll still go by D. It says, what does the future hold for a life-saving? Let me see it again. A portion of the question is cut off. Let me see if I can access the full question. All right. So it says, what does the future hold for a life-saving institution like the NHS, which is struggling to survive itself? Is privatization an option? I'd love to go ahead and then have, Dr. Norman, what if you can take this, and then we can also bring in Dr. Story. And I'll highly recommend that, you be as precise and concise as you could be, so that we can be respectful of people's times.
I think that the NHS can continue to function in its current state. It just needs some changes, and some will say some reforms. I don't think privatization is the answer necessarily. We know what happens in places where there's a lot of privatization, like in the US. The US, I talk about this in the book, the US has one of the worst health outcomes amongst developed nations. And so I don't see that as a thing that the NHS should strive to do. But it needs some reforms, some changes, and we all need to support that, I would say.
All right. Thanks, Dr. Norman. Dr. Story, what's your perspective on that question? With the current state or the struggles that NHS is going through, is privatization an option?
Yeah, I was just going to add on to that. I think whilst it's certainly not, I don't would propose that we go privatization. I think healthcare is becoming more expensive with the more complex conditions that we've got. So it may well be that the NHS free at point of care will be more rationed to acute services like cancer services and those things. So it may well continue to be an expert in certain fields, but may well have to think about supplementing either from the individual or anything else. Certain other non-acute services, that may well be the way that we could expand, because I think you've got to be careful. The victim of success, if you're very good at everything, people are going to use that service, and then it becomes use and abuse. And then it's just a perpetual, it's the definition of unsustainable. And I think we often don't look back at how good we've got in the last 70 years because we just want to strive forward. You know, most of the metrics we're looking at, whether it's infant mortality, whether it's survival from cancer, we're better at all of those things, but we like to continue to be better. But we may need to sort of harness our expectations that we can be world leading at everything, and it's free and it's cheap. I don't think we can do all of those.
Awesome. So great insights there. And then also we have another perspective or an addition to the question. So Shan Oak says, yes, my view is that the UK government is espoused to privatization, copying the US. Creeping privatization is ruining the NHS. And my personal perspective as an MC that lives in the United States, I will tell you that privatization always put profiteering ahead of healthcare delivery. It's about, what are profit margins? Is it something that is sustainable? Where, in most instances, if you don't have a great insurance, the healthcare delivery, it's you are kind of shortchanged. So that would be my individual perspective. So I'll go ahead and open up for the last question. Any other questions or any hands raised? We can take the last question and then we can draw down the curtain on this book launch. All right. Well, ladies and gentlemen, I don't have any questions. Neither do I. Oh, I think one just came through. I would crave your indulgence. I think it's from Shan. So Shan Oak says, UK needs to sort out its taxation. Currently, very rich people are avoiding taxation, so there's not enough money to support the system. And then also, James says that for those who work outside the NHS, what is your shared view on the quality of the NHS? That will be the last question that I'll take. And I'll crave your indulgence to give me about 3 minutes of your time. I know we are on top of the hour. So, like I said, I'll crave your indulgence to give us about 3 minutes extra so that we can take that question. And then if there are any questions also on Facebook, Samuel, if you can go ahead and post them in text chat, we will try or we'll endeavor to see if we can take a few of that. So he says, for those of you that are outside the NHS, what is your shared view on the quality of NHS? So I think that would be a good question for Mike. So Mike, if you could, briefly share with us, quality-wise, what has been your experience with the NHS?
Quality wise, I can't knock it. I basically had been living with angina for years, without realizing, and I'd wrongly diagnosed myself with long COVID, and long way, and that I left. But when I needed the NHS, they were there for me. Yeah, the people
Great.
that work across the road, the Dartel's colleagues, yeah, I haven't got enough words to express how grateful I am, our family are.
Awesome. So thank you very much. So whenever the need has arisen, they've been able to rise up to the occasion. So, ladies and gentlemen, like I made mention of, I really would love for us to be very cognizant of your time. We are just about 3 minutes beyond our allotted time. So what I'll do now is that I'll go ahead and turn our screens and the microphone. Did I say microwave? Is that to say that I'm hungry? Turn the microphone to our chairman to officially declare the book launched, and then we will wrap up. All right, so Dr. Ogba.
Yes. Once again, thank you very much for coming for this book launch. And I hope that this book will be in the library of every person here, not just here, but those of us that have joined through Facebook, through other social media outlets. And please preach this good news. The NHS, there's a lot of good in it, and we need to sustain it. And thank you very much to Dr. Datel for giving us this book. And we also wish to acknowledge the past, the eternal glory of his mother-in-law. And thank you very much, everybody. And by the powers that has been given to me today, this book launch, I hereby close this book launch. Thank you very much to everybody that has attended. Thank you, and God bless.
All right.
Thank you.
So briefly, before we leave and draw down the curtain, so those of you that can, put your faces on the screen, Dr. Norman would love to get a screenshot of the attendees. So please, if you could do us the favor and then show your faces so that we could get a picture of those of us that were in attendance. And that should take us less than a minute. So we just grab a screenshot and then we'll call it a day. Oh, okay. So, he just drew my attention to the fact that, if you have time on your hand and, you can hang out, then we can go ahead and take a picture. But then it's been very insightful. It's been very educative and it's been very inspirational, right? Not only did the book talk about the challenges, but then also it highlights some of the success stories of the NHS that many places can go ahead and emulate. So thank you very much for your time. And Dr. Norman, more grease to your elbows. We look forward to we all converging here again for more insights and more books to come. So those of you that can still hang out, let's hang out and get some pictures taken. Thank you very much. We are very grateful for your time.
Thank you. Thank you, everyone. I'm really, really grateful. I don't know whether Samuel has taken the picture already.
Yes, I have.
He says yes. All right. So I think you can stop recording, Samuel, and then we can socialize. Or do I have to do it myself? All right. Okay. So I think we are now socializing. If you want to, you can leave as well whenever you want. Sean, it's good to see you. Thank you for joining.
You can take your time.
And your husband as well. I could see him in the background.
Yeah, thank you. Well, we were so pleased to see you in Harrogate Hospital when Bill was ill recently. It was brilliant to see a friendly face, and the care there was fantastic. And we know how much everybody's struggling because of the lack of government support to our beloved NHS. And the problem is that I'm a candidate for the parliamentary election coming up for the Green Party. And I talk to people a lot in the street about the NHS. And when you say that it's being starved of resources and they're creeping privatization, the public people they just don't believe it. That is too terrible to believe. They think that we're making it up. So it's so important to get a book like yours out there so that people can find out from somebody who's in the system what's actually happening. So thank you so much for writing it.
Thank you. Thank you so much. And thank you for all the support, for making time to join us and all of that. So we should all try and vote. Sean, and you're standing in Harrogate, is it? So you are up for voting. I mean, people can vote.
Yeah, I'm a candidate for Harrogate and Knaresborough for the Greens, yeah.
All right. And it's Sean Oakes.
Thank you, Data.
Sean,
I started the campaign.
Sean, I don't have a vote, right? But then I was thinking maybe you could share some perspective for me. I know that, politicians, politicians use the NHS as well. And individually, we may mean well. But from a political standpoint, what are some of the key stumbling blocks that you see in the way of NHS quest to improve? Like, what are some of the challenges that, politics brings around when it comes to seeking improvement in the NHS system? Are there any stuff that maybe, Sean,
Oh.
you may be able to share?
Yes, yes.
Sorry, just a second. Samuel, are we off Facebook now?